Generally the blood tests, ones which are HIV, hepatitis and syphilis, will get the result within 24, maybe 48 hours. The swabs and urine tests, which are for chlamydia, gonorrhea, herpes and some syphilis cases, maybe 48, 72 hours. The positive HIV test can take a bit longer because they have to do a sequence of extra tests if they get the initial positive result, so that may stretch out to 3 or 4 days, and a negative result will go back very quickly. Depends how long ago your contact was. We have what are called window periods. It takes a certain length of time for the disease to show up on our test. So in the case of chlamydia and gonorrhea on the tests, the urine tests we do for that, and swabs, most will show within a week of picking it up, basically all within 2 weeks. Syphilis takes a month or can take a month. The hepatitis is usually within a couple of months. Occasionally we get some outliers, anything up to 6 months. HIV, 99% will show by 6 weeks. We still quote a 3-month window to be absolutely sure on that. So yes, it depends how long ago the contact was. Well, you will need to have, at the moment, ongoing lifelong treatment with HIV drugs. But the good news is that drugs these days are extremely effective and extremely safe. In the early days of HIV treatments, drugs which are the opposite of that, they didn't always work by any means and came with a lot of side effects. Nowadays, most people with HIV will just take 1 tablet a day, usually with no side effects at all, and basically get rid of their virus, get rid of it completely with suppressants so that we can't detect it in blood tests, which means that they are undetectable and cannot pass it on to anyone, and they will live a normal length life, which is great news. Which is one of the reasons why there's been a move to get GPs involved in looking after patients with HIV, is to treat it more like another chronic disease.